we're working with governors to make sure that the healthcare providers, the hospitals, and the clinics in their state are placing orders now that this tremendous increase in supply, particularly with industrial masks, is now available. We're going to make sure they understand that the supply has greatly expanded thanks to bipartisan legislation and the accomplishment of the president. And the response by these companies is making more masks available. And we're going to make sure healthcare providers are purchasing those. And the federal government will also make sure that our stockpile properly reflects those increases as well.
So, on the president's question, when will those masks be ready for? Because they need them like today.
They're available now.
They're not. They're absolutely not available now. What the vice president just said, and he's in charge of this coronavirus task force that the president has put together, standing next to the president of the United States, the vice president said something that was not true. So here we go. Bloomberg reports that it could take up to 18 months for hospitals to see supplies from companies making masks right now. Here's how the president addressed the federal government's role in the nationwide shortage of medical equipment.
You enabled, I guess is probably the best way to put it, the Defense Production Act yesterday, but you didn't pull the trigger on it.
No, because we hope we're not going to need that.
You're getting a lot of calls on Capitol Hill from the Democratic leadership to pull the trigger on it. Why? What's the rationale for not doing it?
First of all, governors are supposed to be doing a lot of this work, and they are doing a lot of this work. The federal government's not supposed to be out there buying vast amounts of items and then shipping. You know, we're not a shipping clerk. The governors are supposed to be, as with testing, the governors are supposed to be doing it. We'll help out, and we'll help out wherever we can, and we can buy in volume, and in some cases, great volume. With the masks, as an example, which were really a problem. We have helped out, and there are right now millions of masks being made. But this is really for the local governments, governors, and people within the state, depending on the way they divide it up. And they'll do that, and they're doing a very good job of it. Where you have a problem with ventilators, we're working very hard trying to find. Nobody in their wildest dreams would have ever thought that we need tens of thousands of ventilators. This is something that's very unique to this.
So we're headed to a crisis that this country potentially has never seen in anyone's lifetime. And the president seems to be separating himself from it, saying we're not the country's shipping clerk. He seems detached. He's putting out information that is not true. We'll be telling you later about a drug that he says is approved and ready to go. And his minions on Fox were echoing that fact, which is not a fact, is not true. The vice president now is getting caught up in the president's branding exercise, Willie Geist, naming companies that will be making masks that are not available now. This is a crisis in leadership that is ultimately going to have incredible ramifications for the American people.
It's a crisis in leadership, and it's a crisis in hospitals right now. If those masks were available, as Vice President Pence claimed yesterday, we wouldn't be hearing from hospitals. We wouldn't be hearing from doctors. I wouldn't be getting frantic texts from doctors saying we're down to our last mask or we're already out of masks. And it's not just for the places that are taking coronavirus patients. It's for other hospitals who are being asked to give some of their masks to these critical centers, places like cancer hospitals here in New York City that are out of masks or have a week supply left. They have to get out. They have to move quickly. And here's where we are, Mika, to give you an idea. A group of hospitals in Indiana is getting ahead of the mask shortage by asking the public to sew masks for the hospital. The Deaconess Health System released this video showing the public how to sew a face mask, along with a PDF of the pattern to follow. A spokesperson for the hospital group says its instructions meet CDC protocols and that the homemade masks will be sterilized.
How long does it take to do one?
It takes about 15 to 20 minutes. Obviously, when you first start out, it's probably closer to 20 minutes. As you make several, you'll get a lot faster.
Gene Robinson, I can't believe what I'm watching right there. That's a hospital in Evansville, Indiana, who's doing what it has to do to get through this, pleading with the general public, please at home sew us some masks. If you read through the instructions, then they say, give us a call. We will meet you in the parking lot of one of our facilities. You can deliver the masks. We will then sterilize them. In this country that in 1940 and 1941 turned automobile factories into airplane factories almost overnight, where are the masks? Where are the supplies? Our hospitals are dying out here.
It's unbelievable. Yesterday, the CDC recommended that doctors, who are working on coronavirus patients, if necessary, use a bandana or a scarf, which was, I thought, the most amazing thing I had heard and a shocking thing I had heard until you just played that piece about the homemade masks. It's unbelievable. And for the President of the United States to stand there and say, we are not a shipping clerk, to absolve himself of responsibility when the federal government has a unique ability to commandeer, to order the production of and commandeer those masks and get them to where they need to go. It's incredible. It's, the phrase failure of leadership, I think, is one we've used the past few days. We're going to use it a lot more. But while we're describing this appalling situation, it has real-world effects on patients, on medical care providers. It's just shocking.
Jonathan Lemire, I'm hearing from doctors who I know and doctors who I've built relationships with more recently as we've gone through this crisis, who I know to be strong, calm people. Sure. I'm sensing panic in their voice, fear in their voice as they plea, we need this equipment or else all of the doctors are going to get sick. All of the nurses are going to get sick. Then they won't be able to provide care for the people who are flooding in the hospitals to get sick. Here's another eye-opening number for you. An HHS official at a Senate hearing earlier this month said in the middle of a pandemic, this country would need 3.5 billion masks, billion with a B. We can't even get masks on shelves of these hospitals right now.
Right, and the wave of these cases is like just starting to break.
Yeah.
It's going to get so much worse, according to all health experts. And the hospitals are on the verge of being overwhelmed. We heard Mayor de Blasio in New York City yesterday say that we're 2 or 3 weeks from pure crisis. And it's true. There will be a domino effect. If these first responders, if these healthcare workers, they get sick themselves, then they're taken out of service. And it's the care for the patients just gets it's that much slower and potentially ineffective. And it is. And from the White House, we're still seeing so much was made, entirely too much was made about the President Trump's shift in tone at the beginning of the week. And that has obviously faded as the week has gone on. That's evaporated here. And there hasn't been a lot of strong leadership, to the frustration of some of his aides and Republicans on Capitol Hill who want him to see more. And what we're getting is over-promising. The website that we promised a week or so ago has only just now come to life, and it only serves California. It is not something that is a nationally approved. I know we're going to get into the drugs more later, but the FDA had to put out a statement yesterday cleaning that up, saying, look, these medicines, first of all, we don't know if they're going to work, and even if they do, they're not going to be available for months.
And by the way, John, the head of the FDA was standing behind President Trump when he made that claim, which was false.
Right, and he sort of, in the moment, tap danced around it, but they had to put out a strong statement later, because this is a White House right now that is still trying to win the PR battle rather than actually deliver the ventilators and masks and services to the sick people in this country who need it.
That is exactly the case. That's what I'm seeing completely. That shift in tone, by the way, Jonathan Lemire, I have to say we all recognized it. We talked about it. Some of us lauded it. I think that was hopeful. I think at this point, every American, whether you're a journalist or a healthcare worker or an American citizen, is hoping for leadership at this point. Look at the White House right now. You get a live look at the White House. There's usually the lights on, 6 in the morning, people are working. Lights are out. There's Hans behind him, the White House. I want to get to Hans Nichols, but, you know, what I'm saying is this could be symbolic because you've got American citizens doing social distancing. You've got healthcare workers doing what they can to confront this crisis without the supplies. You've got scientists desperately saying that we are directly on track with Italy, and yet the lights seem to be out completely in the White House. This president seems to be unmatched, and he's putting out false information by the day. The president also claimed yesterday, Hans, that an anti-malaria drug would be available almost immediately to help treat coronavirus. That is not true. Fact check that.